So after you finished your Step 2 CK, is that when you started looking for clinical experience in the US?
Yes. So upon finishing Step 2 CK in early 2019, I spent about 4 months in the United States doing rotations at different hospitals and trying to get letters of recommendation, trying to get access to the electronic medical records and learning to navigate it and so on. And also trying to take up any opportunity to make relationships with residents in the US. I actually did some research with some residents at some of the places I've been at, and I was able to participate in like their didactic sessions, some of their workshops and so on, and even do things like ACLS. So I really tried to maximize my time in the US while I was there rather than just passively rotating.
So was that like an observership that you did?
No, it wasn't. So the main difference between an observership and what I did was with an observership, usually you don't get to actually interact with patients. They kind of call it, that's why they call it an observership. But the type of rotation I did was what some people refer to as an externship or a sub-internship. My ID card actually had sub-internship on it. And this allowed me access to the EMR, participate in rounds, actually examine patients, and so on.
Fantastic. Now, how did you find these positions?
Okay, so I think there are two main ways to get clinical experience in the US. Number one, you could try to get it directly through universities or hospitals offering these positions. Or number two, you could use a third-party company. So right now, currently, there are a lot of third-party companies that like offer packages for international graduates and different types of experiences. And of course, these tend to be more costly than going directly to the hospital. So it's really difficult to get one without using a third party, I think. So you really have to look and you really have to apply and be active and constantly look at your options if you really want to get in some good clinical experience. You also have to be careful that you don't end up at a hospital where you don't get to do much and you kind of don't meet the expectations of what programs would be looking for in your US experience. Because, for example, some programs don't consider doing things like observerships as clinical rotations.
Right. So you just you kind of sent out a lot of emails to different internal medicine programs saying, hey, I'm looking for an externship, a hands-on rotation. Would I be able to work with you? Is that how it worked for you?
Yes, that's how it primarily worked, but I didn't really have much success contacting programs directly. So I ended up using one of the popular third-party organizations, and I tried to use them during a time when they were offering a discount. It was around Christmas time, so they offered like 25% off. So I was able to get something reasonable, I would say. And I took a lot of months with them all at once during that sale. So I was able to kind of circumvent the expensive costs like that.
Fantastic. Okay. Yeah, that's a good strategy too, to kind of go at a certain time when, the prices are more affordable.
Yes.
That's great.